Hello and welcome to episode 98 of the Pet Behavior Chat. And I thought today we could talk about reducing fear, anxiety, and stress at the veterinary clinic. And the reason for that is that I gave a presentation or a workshop in Dubai this past week to a wonderful group of vets and nurses. And I just thought it was a topic that I probably haven't spoken enough about on the podcast. And I really wanted to kind of dive into the things that I think about and essentially give you a bit of a framework. So 4 pillars or 4 big silos or 4 big sort of areas, I guess, that we need to look at when we're thinking about reducing fear, anxiety, and stress at the veterinary clinic. So I will get started on that. We'll go through the 4 points. I will give you some resources at the end of the episode as well. And also, it's episode 98, and there's something very, very exciting happening at episode 100. So I'm going to, just before we sign off, I'm going to set the scene a little bit for what's happening in episode 100. I'll talk a little bit more about it next week as well. But yeah, we're having a big change coming up in the podcast, which is going to be super cool and super exciting. But before that, let's do this piece about kind of our 4 big areas that we need to think about when we're reducing fear, anxiety, and stress at the vet clinic. So number 1 is learn to read body language, facial expressions, potentially vocalization, but essentially canine and feline and whatever other species that you're working with, communication strategies with which they convey or communicate how they're feeling in any given moment. And this is probably, I would say, the cornerstone of everything, because if we don't understand how they're feeling, and if we don't understand whether their emotional state is getting worse, we can't do anything about it. And it puts us in quite a bit of danger in terms of escalating behaviors towards defensive behaviors or aggressive behaviors. So that whole communication piece is so important. And it really is a whole team effort. And everything that we're going to be talking about today really is a whole team effort. But that communication piece is so important. And even if we've worked with animals for a long, long time, it can sometimes be difficult to kind of understand that fully, and especially to recognize some of the subtle signs. So whether it's our amazing veterinary nursing team or even our front of house team or the vets themselves, we all need to be on the same page when it comes to our patients' communication strategies. And there's quite a lot that can be done towards that. So there are some brilliant courses and resources. Fear Free, obviously, has paved the way for this. And they have a brilliant amount of resources, whether that's the ladder of FAS, so the escalating ladder of FAS that uses the traffic light system, so green, yellow, and red behaviors, for us to be able to recognize where on that emotional spectrum our patients are. And I have these resources printed out at my clinic, and they're literally in every consult room. They're also great resources to communicate to clients how their pets might be feeling. So if clients have any kind of perhaps negative reactions towards you, maybe slowing things down, or maybe recommending that you abort the appointment and that they come back with maybe pre-visit pharmaceuticals on board, you can communicate to them exactly and show them in pictures how their pets are feeling, and hopefully that will then cause them to understand why it might be in the pet's best interest to take a different course of action, whatever that might be, whether that's coming back or whether that is maybe sedating them. So using those resources, I think, is absolutely invaluable, but also doing recurring team trainings. So with my team, we do this a lot because sometimes we kind of forget, and we want to make sure we keep our eye in. Whenever we have new team members joining us, we kind of go through the whole thing again. And it's not just the people that are directly involved with the care of the animals, but also the front of house or the reception team. Can be really, really important for them to recognize a patient that comes into the clinic that's maybe feeling really anxious, worried, distressed, and they can then also help to create a better circumstance, maybe by asking the client to wait outside in the car, for example, until they're ready to be seen by the vet. So there are lots and lots of different things that can be done, but it all starts with actually recognizing how that animal is feeling in that moment. It's also really important for sort of inter-team communication. So let's say you've got a vet and a nurse in a consultation together. The vet might be busy explaining something to the client, but the nurse might be picking up on the animals, maybe escalating body language signs, and they can then call that out or communicate that to the vet, so that, again, things can change in the moment. So being able to communicate with each other, understanding body language, it's so important for so many reasons. Obviously, the big one is the patient's welfare and the experience that they have in the clinic, their emotional safety, but it's also our safety from a veterinary team point of view. Because, how easy is it for us to get bitten if that patient, be it a dog, a cat, whatever other species it might be, starts to escalate in terms of their emotional state, and then they start to become defensive, they start to practice those fight behaviors. So it's really, really important for so many different reasons. And then we often talk about the 4 Fs, so fight, flight, freeze, and fiddle behaviors, as all being different strategies that an animal can actually use to show their emotional state. So our flight behaviors are very common. So avoidance, escape, dogs jumping off consult tables, hiding behind their owner's legs, hiding under a chair, trying to get out the door. All those escape behaviors are really important for us to note, because the moment that we can find them and that we perhaps restrain them for handling, those flight behaviors might then switch over into our fight behaviors. And that's when things can start to get really, the safety sort of side of things starts to become tricky, both for the patient, for us, for the caregivers, for everybody involved. So that's fight, flight. The other one that's really important for us as vets to consider is freeze. So those are those animals that go really still on the consult table, or perhaps shut down when they're taken out the back. But those freeze behaviors, even though they might be convenient for us because we can get our job done, it still doesn't mean that the patient is experiencing any better level of emotional state. And when we think about recurring visits or future visits and the learning that comes from today's visit, then freeze is definitely not a good state for our pets to be in. So we always need to bear that in mind. And then the other things are fiddle behaviors. So these are displacement behaviors, coping strategies that dogs might employ, and cats, to cope with a situation better. So that can be, the dog that's overly friendly, jumping up, and you might think that they're actually delighted to be at the vet, but that is a fiddle behavior. Dogs that yawn, lip lick, maybe scratch themselves, those chinchillas that drop all their fur in one go. So some of those things are kind of those displacement behaviors or physiological reactions to fear, anxiety, and stress. So understanding those 4 different categories and how they can be important for us in the veterinary setting all falls under that recognizing body language, facial expressions, potentially vocalizations, and in turn what that means for that pet's emotional state. So that's the first thing. The second thing is creating a calm and safe environment. And that's, again, a whole team approach. It's something that, the reception team can get involved with when they're scheduling appointments, thinking about maybe cat-only appointment mornings. Do you have a Friday morning where you see only cat patients so that the cats aren't faced with dogs while they're in the waiting area, or scheduling appointments so that we don't schedule perhaps a number of fearful patients at the same time that might find themselves in the waiting area at the same time. Can we utilize consult rooms in a really effective way so that our pets don't have to spend that long in any kind of waiting capacity or waiting area? And then, asking them, as I mentioned earlier, some dogs might be much more comfortable waiting in the car until the vet is actually ready to see them. And then they can just walk in, go straight into the consult room, and can be seen immediately. Because the problem with waiting areas, and especially waiting areas that are maybe multi-species, is that those fear, anxiety, and stress levels can already be rising as the patient is waiting to see the vet. And then once they see the vet, it's going to be much more difficult for the vet to examine them and handle them. So some of those things around scheduling and waiting areas and making sure that we keep those to the bare minimum are really important. But then also, what else can we do in terms of our environment? We can use pheromones. So we can use, for example, Feliway for cats and Adaptil for dogs, whether that's, we spray blankets beforehand and cover the cats' carriers with them. or we spray Adaptil on a bandana and just pop that around a dog's neck as they're waiting. We can have plugins in the waiting areas or the consult rooms. So all those things are important. And that leads me to carriers, specifically cat carriers. So we never want to have carriers on the floor. We always want to have them elevated. If it's appropriate to do so, we want to cover them to block some of those visual stimuli and impressions. And also giving clients information ahead of time on how to bring their pet to the veterinary clinic. I've seen so many cats that have literally just been carried in, which can be so dangerous. I've also seen cats that have been in completely inappropriate cages. And again, that being in that inappropriate travel carrier on the way to the veterinary clinic is already going to escalate their fear, anxiety, and stress levels. So again, so much that can be done in advance. And one of the other things that can be done in advance is, in order to sort of create that calm, safe environment and setup, is looking at the pet's previous records. Of course, that means that at the previous visit, the person, whether that's a vet or a nurse, needs to have documented their findings. So, perhaps made some notes on the PMS system about, this pet was really anxious in this sort of situation. They were much better on the floor as opposed to on the table. They really enjoyed this type of treat. They really appreciated this type of handling. Or maybe, with this particular patient, you only have 5 minutes before their resilience starts to sort of break down and they're not able to cope with the situation anymore. So the more we can document our findings, and then the more we can read those ahead of time, that can then also allow us to prepare the environment appropriately for that patient. So that's also part of creating this calm and safe environment. Other things to think about are noises and smells. So any kind of sensory input into that patient. So things they can see, things they can hear, things they can smell. So making sure that we empty bins regularly so there's no soiled material from previous patients. We know that our pets can communicate very, very well through pheromones. So making sure that we keep all the areas really clean, especially if we've had a patient in prior that has maybe been quite anxious. So all that sort of thing, smells, and then also noises. So phones, can they be switched down to kind of their lowest ringing volume? Can we move printers or other noisy bits of equipment into office spaces or out of the way of the waiting areas? Can we ourselves speak in a way that is going to be less stressful for our patients? So all those things can be really, really important when we're thinking about creating that calm and safe environment. So those are the first two pillars. Excuse me. Okay, those are our first two pillars. So that's reading body language, understanding emotional state, and then creating that calm, safe environment. Now, the third pillar is all to do with actual handling. And I'm going to talk about two different things here. The first one would be our in-the-moment gentle handling techniques for patients that are in the veterinary clinic. And then the other thing is potentially teaching our patients cooperative care cues or methods, which will serve them and you as vets and their caregivers over a longer period of time. So number one, what's the difference between gentle handling and cooperative care? Well, gentle handling are how, as I mentioned, how we deal with our patients in the moment, and I'll chat you through some of those. And cooperative care is actually teaching them operant behaviors, so cued behaviors that they can do in order to kind of take part in their own care. And the cooperative care piece actually stems from, dealing with wildlife or perhaps zoo animals that would be very difficult to restrain or handle for any kind of procedure. So I'm sure many of you have seen, videos on YouTube or social media where you have, lions that open their mouths on cue so that we can look at their teeth, or, we perhaps have larger animals that learn to maybe put their extremities, their foot on a certain box for an x-ray, or that present an extremity for a blood draw. So these are all cooperative care methods, and they do take a little bit longer to teach because the animal has to learn the cue. I mean, it can happen quite quickly if it's done by a very skilled trainer, but it usually takes a little bit of preparation. So it might not be the thing that you can use in the moment for your patient as they're in the clinic with you, but certainly for patients that need chronic care. So let's say an atopic dermatitis dog that needs, regular ear cleaning or regular medicated baths, or an ophthalmology patient that needs chronic eye drops. So for all those types of patients, teaching them some cooperative care strategies can be really useful, because they're going to be having these treatments for a number of years or over a longer period of time. And so having that be a stress-free event for them is really, really important for their welfare going forwards. So cooperative care is something really, really cool, and there's lots of things that can be done there, but it is something that takes a little bit of time, but it does really impact positively the animal's welfare, because they have a choice to engage and cooperate in their own care. So that's a very, very cool thing to do. Now, gentle handling techniques really are everything from getting the cat, for example, out of the cat carrier, all the way up to how do we perhaps hold them or handle them while they're having procedures done. And there's quite a lot that goes into that. But some of the big things I would say are, some of the basics. Let's start with cats, such as not shaking cats out of carriers or reaching in there and pulling them out. Absolutely no scruffing. So a lot of things that we can find in the 2022 feline ISFM and AAFP feline handling guidelines, right? So which is never scruff a cat, never use clipnosis. So that would be using clips, such as maybe washing clips or other paper clips on their scruffs to immobilize them. And also never using full body restraint techniques on cats. So we used to really quite like these burrito techniques, where we would quite tightly wrap cats in order to restrain them. That's something that's fallen out of favor and is not really something that we want to do anymore. Similarly, a number of other things, such as using gauntlets, using induction boxes, using cat muzzles, using air muzzles for cats, using these kind of mesh traps. There are so many things that I think have historically been done to restrain cats, and these are all not recommended anymore. For dogs, we have a couple of restraint techniques, such as muzzles, that can be really, really useful. However, only if the dog actually feels comfortable wearing a muzzle. So again, that might be another thing that we need to teach that dog over time. If we know it's a dog that's super fearful at the veterinary clinic, and it might be safer to muzzle them, then that's something that we have to again operantly teach them, and the dog has to feel comfortable wearing a muzzle when they're in the veterinary setting. Now, as an emergency procedure, if we absolutely have to get something done, we might need to muzzle a dog, but I'm going to give you some other strategies as well. And also, if that is the case, then we definitely want to recommend to the client to go away, find a great trainer, and teach their dog to happily be muzzled for future handling, veterinary visits, maybe even grooming visits, and so on. So those are some of the things I think that we kind of are basics, just to lay the foundations. Then, of course, we have our different ways of holding and restraining. So we always want to use our hands and our bodies in a very kind of supportive, consistent way, so that our pets feel safe. So making sure that the pressure that we apply and the way that we handle them once we're actually handling them is really consistent. I have found that many pets really don't like sort of hands on and off and on and off frequently. So having that, what we call touch gradient, so gently and soothingly putting hands on with, a really appropriate pressure for that particular patient. And things like preparing our tools and our room ahead of time, so that once we start examining, handling the patient, we're not then distracted. We have to run out the room to get our stethoscope, or we have to then take our hands off the animal to open our syringe packet, or, get the otoscope or whatever. Make sure you've got everything pre-prepared and there, all the things you think you might need, so that once you start, you can fully focus on your examination process and procedure. And you don't need to, be on, off, stop, start, which can sometimes be extremely stressful for a lot of patients. Then we've got a couple of different types of holds that we can use. So the U hold, where you perhaps restrain a dog or a cat maybe, but more commonly in dogs, close to your body by putting one hand under their sort of neck area, another hand under their groin area, so that we've got a nice stable hold. We can also use, if we've got a large breed dog, we can use our feet or our legs to kind of be a bum stop, maybe as we're elevating their necks to get a jugular draw, for example. So all these things are really great. And then we've got some ways that we can maybe enhance those holds. So maybe by blocking their vision gently with a towel. So lots and lots of different things that go into that actual handling process. And for anybody that's interested, the low stress handling techniques by the late Dr. Sophia Yin, which is now part of the VIN, the Veterinary Information Network family, and Cattle Dog Publishing. And we actually had the second edition of that book that came out just last year. So it's really brand new and updated. Those are all great places to go and look for some of these handling techniques and holds and so on. So that's something I would recommend to anyone that's interested in that. So that's the fourth pillar we've got. So pillar number one, just to remind everyone, was reading body language and emotional state. Pillar two was creating that calm, safe environment. Pillar three are actual gentle handling techniques and possibly teaching cooperative care techniques. And then our fourth pillar is using pre-visit medications, maybe supplements, pheromones, as I've mentioned already a little bit, and maybe diets, although they're probably not so good in an acute situation, as ways of preparing them. Actually, before we do pillar four, I need to quickly come back to pillar three. I forgot something, and that was distraction and luring. So providing distraction with food, treats, as long as they're appropriate for that pet to have in that moment. So if you've got a patient that's come in for a GI issue, or maybe it's a pet that has known food allergies, then obviously you need to adapt whatever food treats you have. But distraction with food, with, whether it's peanut butter or squeezy cheese, dogs often love fish, or even, cat food, kitten food for that quick blood draw that you need to do. So distraction is a great thing. And if they can't have food, then oftentimes play or even smell can be a really great alternative. So we'll often use scent boxes. So we'll kind of make a cardboard box with lots of different smelling items in there. If you've got a rabbit staying with you in the hospital, you might pick up some straw. Or if you have somebody who's horsey in your team, ask them to bring in straw from the stables, and obviously change it frequently. But some of those really kind of enticing smells, you can have different types of safe herbs that you put into a sock, for example. You can, of course, put treats, if it's appropriate to do so, in your scent box as well. But for some animals that can't have food distraction, smell distraction can be really valuable as well. So food, smell, play. For cats, that could also be catnip. Again, that can be play. That can be the churros. I mean, what did we do before creamy treats or churros came along for cats? So all those things can be distractions. And you can then also use those to lure the animal into certain positions, onto a weighing scale, into a position where you can then examine a certain body area that you're interested in. So distraction and luring also falls under that third pillar, which was handling, gentle handling and cooperative care techniques. So yeah, sorry, I forgot about that one. Right, now back to pillar four again, which was using pre-visit medications, pheromones, supplements, and maybe diets. It was the diet that made me think about the luring and the distraction. So obviously pre-visit medications have been a massive game changer for us in the veterinary setting, and I think are very commonly used now by many practices around the world. Maybe not as commonly, maybe as we would like them to, but I think definitely things are progressing. And so some of the medications that fall under this bracket would be gabapentin, especially for cats, or pregabalin. We have a new licensed form of pregabalin for cats in a liquid form for vet visits called Boncat. So that's something to maybe investigate if that's available in your country. So gabapentin and pregabalin. Then trazodone for some pets. Some pets have the opposite reaction to trazodone. So trazodone can often be very calming. Some pets have an adverse response or an opposite response whereby they become very agitated or excited. So that's something, trial doses at home are always really great ideas. So gabapentin, pregabalin, trazodone, and then we have our alpha-2 agonists. So for dogs, we have Cilio, which isn't licensed for veterinary visits, but can have a really great effect. So Cilio is dexmedetomidine, an oromucosal gel that can be given in the short term prior to vet visits. Clonidine can be used. Again, there's a new product on the market called Tessie, which is tasipimidine, which is also an alpha-2 agonist, might be quite good for hospitalized patients. So that's something to think about. And then finally, we have our benzodiazepines. They definitely need trial doses at home. They can have side effects such as excitation. So again, can cause kind of hyperexcitability or hyperexcitation, and can what we call disinhibit behavior, which can cause them then to perhaps show aggressive behaviors. Now, there's a lot of chat about whether benzodiazepines cause amnesic effects and therefore actually cause the animal to forget all about the vet visit that they had. And I guess we're not sure. Probably injectables such as midazolam have an effect like that. Whether an oral fast acting might have an effect like that, maybe, but I think it's difficult to know for sure. However, if the patient tolerates a benzo and it makes them really chilled out and calm, that might, in inverted commas, be a nice kind of positive side effect from that. So benzos, probably my last resort usually. I usually try and go through everything else. And then remember, you can combine different medication as long as they're from different classes. So you could combine something that acts on the GABA system, such as gabapentin and pregabalin, together with something serotonergic, such as trazodone, together with something that acts on the noradrenaline pathway, such as an alpha-2 agonist. So that way you're targeting different neurotransmitter pathways, and you can perhaps use medications in combination at a slightly lower dose, which will reduce any potential side effects from those meds. Side effects are usually not very common and transient. The most common side effects would be sedation, ataxia, maybe some gastrointestinal side effects. The side effects go away some hours after the end of the effect of the medication. So something just to think about. So medications are a really great tool to use as that fourth pillar. And if you want to learn more about meds, especially those short-acting meds, then my Psychoactive course is absolutely a great course for you. It is quite a comprehensive psychopharmacology course, but certainly those sort of pre-visit medications are talked about quite a lot, both when I talk about short-acting medications in one of the big modules, but also when I talk about how we actually practically use psychopharmacology in module 5. So if anybody's interested, I'm going to put the link to Psychoactive in the show notes, but that's a really, really great course to get started on. There is a payment plan for Psychoactive. So if you can't pay everything up front, you can pay over 6 months. So that's a really nice way of doing it. So have a look at the link. There's lots of different options in there for you. Now, so those are the medications, our psychopharmaceuticals. Now, supplements and pheromones are an interesting one to talk about, because we always need to think about what is the level of anxiety, fear, anxiety, and stress that we're trying to tackle. And is a supplement or a pheromone able to reach that sort of level of arousal, fear, anxiety, and stress? And many of them are not. So if we have very fearful or very stressed pets at the veterinary clinic, a supplement is unlikely to be able to reach that sort of effect. Then we really need to go for a psychopharmaceutical medication. However, if we have patients that are only very mildly stressed at the veterinary clinic, or that are not really stressed, but we want to ensure that they continue to have a positive experience, then absolutely we could reach for a supplement. One of my favorites is Zilkine. I also like Angzitane. I also quite like Carmex from Vet Plus. So those could be some of the supplements that you could reach for. So those things so that would be my fourth pillar. Now, very interestingly, there was a study that was done, I think it was in 2024, I can't remember the year exactly, But a study that was done by my residency fellow, Dr. Alison Gherkin, who practices in the US, and they looked at whether cats that respond aggressively in the veterinary setting also show increased risk of behavioral signs at home. And they did find a correlation between aggression in the veterinary clinic and aggressive and anxiety-related behaviors at home. So if you have a cat that comes into the veterinary clinic that is really, really aggressive, or that's really so fearful that it's showing a lot of aggression, you can absolutely question the caregiver about how are they doing at home, because it might be that they might need some behavioral support in the home, and then you can either refer to a veterinary behaviorist, or if you've got somebody on your team that likes behavior, or if you yourself really like behavior, you can then kind of dive deeper into that. And interestingly, Dr. Gherkin and her colleagues that conducted that research found, I think it was around 42% of cats that go to the vet actually react aggressively. So that's quite a big number. 4 out of 10 cats that go to the veterinary clinic are so stressed that they show aggressive behaviors. So again, it's a really kind of big indicator that we need to manage that emotional state in the veterinary clinic using the 4 pillars that I've just given you, but also that we then kind of dive a bit deeper for those cats and actually see how they're doing at home and whether there's any support that we maybe can provide them at home. So that is everything for my 4 pillars. Now, I did say I was going to give you a little bit of a teaser of what was upcoming. So at episode 100, we are going to be changing from the pet behavior chat to the veterinary behavior chat. So the podcast is going to go through a bit of a rebrand, and we're going to launch it as the veterinary behavior chat because I really want to focus on providing information for vets, vet nurses, and other pet care professionals. So we're going to really kind of hone deep in on what are the things that you guys need in your daily practice to be able to support you better. And we've got some super cool episode types coming up. I've already got some amazing guests lined up for the first few episodes after we change over. And we also have some super cool 15-minute speed coaching episodes coming up where you as veterinary or pet care professionals can apply to come on the podcast, ask me your burning question, probably only one, and I give you a speed coaching session for 15 minutes. Now, 15 minutes is 15 minutes. I set a timer and we kind of stop when the 15 minutes are up, and we get as far as we get, but they're going to be such cool, fun episodes. So if anybody wants to apply to be on a speed coaching episode, I'm going to put the link in the show notes where you can apply. I'll put the link to the Psychopharmaceuticals course in there as well. I will drop the link to Dr. Gherkin's paper about the aggressive cats, so veterinary clinic versus home situation. And I'm also going to put in the show notes the link to our Trinity client handouts ebook, which is an ebook. And I've actually just finished another handout that's going to go in there, an ebook that gives you lots and lots of client handouts. So if you want to give your clients some additional information about anything sort of veterinary behavior related, veterinary behavior medicine related, but you don't have time to do so in your consult, then you can send them away with a handout and they can then either go and get some further help themselves. It might set you up to be able to refer them maybe to behaviorist, or you can bring them back to your own practice, maybe for a behavior focused consultation going forwards, if that's something that they're interested in. But it just gives you some resources to help educate your clients about veterinary behavior medicine. So that's a little bit of a teaser for what's upcoming and a couple of resources that might be able to help you. But I hope you found this episode useful. Now, the way I always think about this 4 pillars analogy is that it's like a table with 4 legs, right? And each of those legs is really important. And if you don't pay attention to one of the legs, you're going to have a very wobbly or even falling over table. So make sure you consider all of those approaches. So the reading the body language, the creating that calm and safe environment as best as you can, the gentle handling and cooperative care techniques, and then, of course, the use of our pre-visit pharmaceuticals, maybe supplements, maybe pheromones. All right. I really hope you've enjoyed this episode, and I look forward to seeing you next week for episode 99. Bye for now.